So we'll be talking about three types of deformities. All right, postural deformity, structural deformity, and fixed deformity. All right, just making some one or two um, notes, just defining them. Okay, so for postural deformity, we say that a postural deformity is a type of deformity in which the patient can, if properly instructed, be able to what? Correct it. Okay, so it's postural, right? Postural. So it's simply what the deformity came in as a result of the way you stand, the way you post your body, and all of that. Okay, so if you can able to correct yourself, the deformity will correct. Okay, for example, thoracic kyphosis due to slumped shoulders, right? So postural deformity may also be caused by a temporary muscle spasm. Okay, so that's it for what for postural deformity. Okay, can be corrected if the patient is instructed properly. Then for structural deformity, so that this is a deformity in which it results from a permanent change in anatomical structure, but can be voluntarily what corrected. Okay, so it is important to distinguish postural scoliosis from structural scoliosis. Okay, so the former is non-progressive and benign, and the latter is what usually progressive and may require treatment. Okay, so fixed scoliosis is what progressive, may require what. All right, so it's just like postural is a more soft condition than structural. You get. Therefore, fixed deformity, so that this term is ambiguous. It seems to mean that the joint is deformed and unable to move. Not so. It means that one particular movement cannot be completed. Okay, so thus the knee may be able to flex fully but not extend fully. You understand? So that's what fixed deformity actually means, right? So at the time, okay, at the limit of its extension, it's still fixed. Okay, in a certain amount of flexion. All right. So this would be called a fixed flexion deformity if you are going to put it properly. All right. So fixed deformity is more of like you can do one movement, but you cannot do the other movement complete. Right. So that's why they say complete. Right. So on that basis, that's the difference between what postural deformity, structural deformity, and fixed deformity.